Hey guys, welcome to Live at 5 here with Valencia Medical Center. It's me and Bianca today, and we have a special Live at 5. We're going to be talking more about, father's health, because it's Father's Day coming up in a couple of days. So we're going to talk a little bit more about mental health. And I know we had a few questions that we're going to go throughout, but if you guys have any additional questions during the live, obviously send them to us and we'll be more than happy to answer. And happy Father's Day to all the fathers.
Yes, happy Father's Day to all of those fathers. All right, we did already get a few questions in. So kind of our first topic is the erectile dysfunction and low testosterone. And some of the questions are, how does a patient know if they have erectile dysfunction? Or what are the treatment options for erectile dysfunction? Let's start there.
Gotcha.
That's what it says. How do I know? Let's start with, what are the treatment options for that first?
Alright, yeah. So with ED, the signs, I guess we can start there. The signs is, harder. If it's harder to get an erection, if it's harder to maintain an erection, those are all, signs of erectile dysfunction. Sensation can be also decreased, and that can also be a sign of low testosterone. It might be the low testosterone that's contributing to the erectile dysfunction. It might be a couple other reasons. I know last week we talked a lot about ED, and that's probably why some people were still kind of following up on that and asking about that topic. But so the symptoms are going to be decreased erections, less sensation, kind of softer erection than before. And treatment options can vary. If it is caused by low testosterone, replacing testosterone can be a great place to start. We also do offer shockwave therapy, which can be helpful in some people. And then there's the PRP shot, the PRP penile shot, which is also, PRP stands for platelet-rich plasma, full of growth factors, and that's injected in the penis, and that can also help revitalize tissue and help with the growth of blood vessels. And as we know, with erection, the blood flow is very important for that. So if we can help with the blood flow, that tends to help.
So is it a permanent or is it temporary?
The treatments are gonna be, it's gonna vary depending on which treatment we're doing, the length of time that treatment is gonna last for. But and also depending on what's causing the ED, if it is low testosterone, then you're gonna have to, replace that testosterone on continuous basis. Some treatments you have to do once a year or once every couple years. Some of them are kind of more closer together. So it really does depend on the treatment. But, it's usually a maintenance treatment, like maybe a year apart for the PRP penile shot.
And if a patient decides to take testosterone, how is that monitored? Do we monitor it through labs? Do you do prescriptions, injections? How does that work? And how often can they do that?
Sure. So yeah, definitely the monitoring for testosterone labs are going to be very helpful with that. So before we initiate testosterone therapy here, we kind of get the baseline labs to see where the testosterone is and if they are in fact deficient or not. But also symptoms, because different people, different bodies are adjusted to kind of different levels of testosterone, and someone might be doing just fine at a testosterone level of 300, but somebody else, they might be suffering from symptoms at that same testosterone level because their body just needs a little bit more testosterone. So it's a combination of labs, the history. We sit down, we talk to the patient, we figure out what symptoms they're having and see if it matches. And then the treatments, can be, there's different options of treatment. There's creams, there's injections, there's pellets, and there's dissolvable tablets. So there are different options, but each kind of has its pros and cons, and so we try to customize it to each client.
And is there a certain age for this? Do you notice a certain age, or is there an age limit, or when they can start doing this if they feel like they have low testosterone?
So the low testosterone, can happen at any age, but there's definitely a higher prevalence as we age. So with more time, we start to decrease our production of testosterone. So it does tend to happen more and more often as people get kind of older, but it can definitely happen to some at a much younger age.
Okay. We also had some questions regarding IV vitamin therapy, especially now with it getting hotter, that sort of thing. So is there an age limit? Like, my dad's 60 years old. Would that be a good treatment for him at that age, at 60? Or what benefits would the IV therapy give to an older gentleman?
Yeah, there is no contraindication between, IV vitamin therapy and, and age for the most part, especially when, a lot of our clients are in their 50s or 60s. Some are younger, some are a little bit older. But IV vitamin therapy is just, as the name says, it's vitamin therapy that's given through an IV. So we're doing a lot of vitamins. We're not doing anything that's foreign to the body. These are all vitamins that people have been exposed to before, and they're getting through the food, but they might not be getting as much as they can use. So we're just kind of giving an additional amount of vitamins. So, an age of 60 or even much older is not really a contraindication to IV therapy. It can be very helpful for people, especially if they feel like they are deficient in some vitamins and they need kind of an extra boost of, like let's say vitamin C right now, or the B vitamin, or magnesium or calcium or zinc or some of the other vitamins and stuff that we.
Do you tend to lose or become deficient in these vitamins as you age, or is that just based on your diet and environment kind of thing?
Probably the diet is what's going to play the kind of most role, and the thing with the diet is, obviously it's great if you can eat, if you can all eat great and get all our vitamins and stuff from food, but the first part of it is that most of us unfortunately don't stick to the ideal diet most of the time, and so we don't get as much vitamin and nutrition as we get. The second thing, there's a lot of studies right now that suggest that even if you are eating the right stuff, the food itself is many times deficient in vitamins. So there's like one study that would compare like how the amount of nutrition in an apple right now as compared to an average apple 60 or 70 years ago, and there's kind of indications and suggestions that look that even just because of the way the farming and I don't know the exact reason to be honest, but obviously with the way agriculture has been working has been a little bit different. So even if you're eating like healthy food, a lot of times the food itself is deficient in nutrition. So someone might have been getting all their vitamins with a similar diet like maybe 100 years ago, but now just because of the way the food is processed, even if you're eating the same way, which most of us are not, but even if you are eating the same way, you still can be deficient in many vitamins and nutrition just because they're found less and less in some foods now, unfortunately.
All right. How often can you get IV therapy?
So for the most part, depending on the actual IV bag that we're given and what we're giving the client in that regard, there can be there are some vitamins that sometimes when you use there might be some limitations, but most other vitamins are very safe even if you give high doses. A lot of people like to do IV vitamins if they're doing it consistently once a month. So I would say once a month is kind of the most common average for many people, but you can definitely do it more often. There are some people who are having let's say especially tough week and they want to get it a couple times that week, or they're traveling or they're not feeling too good. You can do it more often. Some people do it spread it out less often, but once a month is pretty good for most patients, but if you need to do it more often, that's not usually a problem.
All right. Another topic we have is PRP hair restoration. So, in my family, we have a lot of balding men that are happening. My uncles, my dad kind of thing. So, are they good candidates? If they've already gone bald or if they're going bald, are they good candidates for PRP hair restoration?
Yeah. So if someone's completely gone bald, they might not be the best candidate for it because it's not gonna regrow new hair where there's absolutely no hair left.
Okay.
But if they are in the process of going bald, or in other words, if their hair is thinning, if they're starting to lose some hair in certain areas but not in other areas, then PRP can be a great option. Again, this is a general conversation, so we have to talk to each person individually to see if there's certain contraindications. So not everyone is automatically 100% candidate all the time, but generally speaking, if someone's is pretty healthy overall and they're just feeling that their hair is thinning, they're starting to lose some hair, they're maybe not completely bald yet, but they are starting to get some spots where there's less and less hair, then you can try to slow down the process. You can try to help restore some of that thickness, some of that vitality to the hair with PRP. So it can definitely be a good option for that. That's the main reason we do it in the hair, and that's why a lot of times too, when people are getting a hair transplant or they have a completely bald spot, so they need to get transplant. They still do PRP before and after, just to kind of really help the hair that's there and help kind of because we do on the scalp, so it helps kind of nourish this whole field with the platelet-rich plasma. So.
How many treatments would you recommend if somebody is a candidate to get this PRP hair restoration? How many would you recommend?
So generally speaking, most people do a couple of treatments initially, maybe 2, maybe 3, maybe 4, let's say 6 to 8 weeks apart, and after that it would be less often, obviously, but it would be for maintenance. So 2 to 4 initially tends to be where most people are gonna fall, and then after that maybe once a year, once every 15 months, once every 9 months, again depending on the severity of each case.
Okay, and we did have a question about do we have any promos or specials for PRP hair restoration? So we really just recommend that you call our office to schedule an appointment. You can talk to our patient coordinator, Cassie, and she'll be able to help you and get you all set up and discuss with you what's required to come in and to get that consultation. One of the next topics is PRP joint injections.
Mm-hmm.
So if a patient is getting or has PRP joint, what kind of activity levels, like if a dad comes in or he's a golfer and he's having elbows or knees, can he continue with that? What are the activity levels after you get PRP?
Injection? Most people tolerate the injection very well. We just ask you to kind of take it easy for a few days after. We do sometimes treat some professional athletes, and in that case, we might have them kind of stop their practice for a week or so, but really you kind of get back to your own activities kind of as tolerated. So we don't want you to put too much. We want you to actually, after you get your PRP, to kind of move around a little bit depending on how much you're able to, and obviously your starting level of activity will also play a role in that determination, because some people, like I just mentioned, are athletes and they're still doing everything. They're doing more activity than most of us on an average day, but they're having certain issues, certain pain, and they do the PRP. And then on the other, we have people who can barely walk, or they can only, they need a walker or some assistance to walk, and they're not really doing much with their knee to start with. And then we see those people too for PRP joint injection. We see everything in between. There's always a question of how much activities you were doing before you got the injection, but more or less you can kind of get back to the same level of activities within a week, many times even before, within 2-3 days. And even during these 2-3 days, for the most part, you're not gonna have to be bedridden or anything. You still can do most of your activities. You just want to take it easy and kind of increase your activity as tolerated over the next few days.
All right. We had a patient say that they have been hearing about stem cells and they want to know what is the difference between the stem cells and PRP that we do.
Sure. So, there's the bone marrow stem cells, for example. So when we're talking about PRP, we're talking about platelet-rich plasma, and those are the cells. So both when we're talking about stem cells and PRP, we're talking about cells in your body that are used because of their potential ability to heal tissue and rejuvenate tissue. And so these cells are extracted from your body, for example, and and inject it in the joint, to help repair the process. With PRP, it's the platelets in your blood. That's why we get the PRP stands for platelet-rich plasma. Stem cells, usually if we're doing stem cells for joint injection, most of the time they're extracted from bone marrow. So stem cells, depending on the procedure, stem cells usually tend to be a little bit more powerful, but that being said, it does tend to be a little bit more aggressive in terms of like being able to extract, because we have to kind of get it, like let's say a lot of times we do it from the hip bone where we're doing the stem cells, so we have to kind of dig in the bone to kind of observe the cells from there. So it can be definitely a little bit more painful, a little bit more involved than PRP, which is a lot easier because it's just kind of like when you go to your doctor and give blood for, it's very similar to that when you're giving blood for any other reason. So it's a lot quicker. We don't have to like kind of dig into any bones or anything. But so they're meant to do the same thing. They're both cells that are used. They are concentrated and used and re-injected in the body and used to help start the healing process. They just do it a little bit differently, and the way of extracting them is a little bit different.
Okay. So thank you everybody for joining us, and that's all the questions that we have for today. Thank you, Doctor, for all your answers. We appreciate you guys joining us live at 5-ish on Fridays.
5:30 today.
5:30 today. Well.
All right.
Thanks,
Thank you,
guys. Happy Father's Day.